Do you know the difference between a cardiac arrest and a heart attack? This question might seem simple, but the truth is, many people use these terms interchangeably, blurring the lines between two very different medical emergencies. It's a common misconception, one that can lead to confusion and, in a critical moment, could mean the difference between life and death. Today, we're going to take a deep dive into both conditions, exploring their causes, symptoms, and how they're treated. We'll be shedding light on why it's absolutely essential to distinguish between a cardiac arrest and a heart attack. So whether you're a health enthusiast, a concerned relative, or just someone aiming to stay informed, this knowledge could be invaluable. Understanding these heart conditions is not just for medical professionals, but for everyone. Because when it comes to heart health, knowledge truly is power. So buckle up and prepare to gain some potentially life-saving insights. Stay tuned to understand the crucial differences between these two heart conditions. First, let's delve into what exactly a cardiac arrest is. Picture this. The heart is a fascinating, powerful organ that beats roughly 100,000 times a day, pumping blood throughout your body. Now imagine suddenly it just stops. That's cardiac arrest. It's a swift and unexpected loss of heart function. But why does this happen? It's primarily an electrical problem. The heart has an internal electrical system that controls the rhythm of the heartbeat. In a cardiac arrest, this system malfunctions, causing the heart to start beating irregularly, a condition known as arrhythmia. This erratic heartbeat prevents the heart from pumping blood to the rest of the body, which can lead to a complete stoppage, and well, that's not good news. Now, what does this feel like? For those experiencing it, cardiac arrest is usually dramatic and distressing. Symptoms can be instantaneous and drastic. They may suddenly collapse, lose consciousness, have no pulse or blood pressure, and stop breathing. Some people may experience a racing heartbeat or feel dizzy beforehand, but often there's no warning at all. The thing about cardiac arrest is that it's a true medical emergency. Every second counts. Without immediate treatment, the person will die within minutes. It's a dire situation, but there's a silver lining. Immediate cardiopulmonary resuscitation, or CPR, can provide a glimmer of hope. It can help maintain some blood flow to the heart and brain until medical help arrives. So, in essence, a cardiac arrest is an electrical failure in the heart that causes an irregular heartbeat. It's sudden, it's severe, and it requires immediate action. But remember, knowledge is power, and understanding what's happening is the first step to saving a life. If you're enjoying this video so far, subscribe to our channel for more interesting videos. Now let's continue. Now let's shift our focus to understanding a heart attack. Unlike cardiac arrest, a heart attack is fundamentally a circulation problem. It occurs when blood flow to a part of the heart is blocked, typically by a blood clot. This blockage can be the result of years of cholesterol, fat, and substances build up on the walls of the arteries, forming a plaque. When a plaque breaks, a blood clot forms around it, potentially blocking the blood flow through the artery. The symptoms of a heart attack include chest pain or discomfort, but it's not always as dramatic as you might think. The pain can feel like a squeezing, fullness, or pressure in the center of your chest. This discomfort might last for more than a few minutes, or it could come and go. It's also important to note that heart attack symptoms aren't always centered around the chest. You could feel discomfort in other areas of your upper body, like your arms, back, neck, jaw, or stomach. Shortness of breath is another key sign of a heart attack. This can occur with or without chest discomfort. Some people might also experience a cold sweat, nausea, lightheadedness, or even fainting. The tricky thing about heart attacks is that the symptoms can be immediate, or they can come on slowly, over hours, days, or even weeks. And the longer the blood flow is blocked, the more damage the heart can sustain. That's why it's so important to seek medical attention at the first sign of a heart attack. Prompt treatment can save your heart muscle and your life. So, when we talk about a heart attack, we're really talking about a circulation problem. It's a situation where the heart's blood supply is blocked, causing part of the heart muscle to be starved of its vital blood and oxygen. If left untreated, this can lead to severe damage to the heart muscle, which can be life-threatening. A heart attack, therefore, is a circulation problem that interferes with blood flow to the heart. Now that we know what each term means, let's highlight the key differences. First off, let's look at the root causes. Cardiac arrest stems from a disruption in the heart's electrical system, causing it to suddenly stop beating. This can be triggered by a sudden force impact to the chest during sports activities. There have been many instances of sports players having cardiac arrest. On the other hand, heart attacks are typically brought on by coronary artery disease, which blocks the blood flow to parts of the heart. Symptoms are another key distinction. Cardiac arrest often strikes without warning, leading to sudden loss of responsiveness and lack of pulse. In contrast, heart attacks may present symptoms like chest pain, weakness, and shortness of breath, often building up over time. When it comes to treatment, time is of the essence in both cases. During a cardiac arrest, immediate intervention is crucial. The American Heart Association recommends prompt CPR and automated external defibrillator use to restore the heartbeat. In the case of a heart attack, emergency medical assistance is needed to restore blood flow to the heart, often through medication or surgery. Lastly, let's talk about prevention. While some risk factors like age and family history can't be changed, others can be managed. Regular exercise, a healthy diet, and avoiding tobacco can lower the risk for both conditions. Regular checkups and screenings can also help detect potential issues early. Although both conditions are serious heart emergencies, understanding the differences can help in recognizing and responding to these emergencies more effectively. After all, knowledge is power, and in this case, it can be the difference between life and death. If you don't know how to perform CPR, we encourage you to get trained. Check online for the nearest CPR training. If you enjoyed this video, give us a thumbs up and don't forget to subscribe to our channel for more educative videos. Until next time, remain curious.